Live from the Channel 11 studios, it's Great Day Houston. And here's your host, Whitney Casey.
You know what? Your smile is just as important as your makeup. And you can't hide those teeth. You can't hide those things. So I was looking into, I've never understood what an implant is. I understand, you know, like there are caps and there are all these things, but what are implants? So I looked it up online. Okay, now this is, we aren't going to show you this, but I Googled it, and you know, there's video online everywhere. Yeah. Just FYI, don't watch this before you're going to go to bed. Watching an implant procedure, not so good before you go to bed, not so good. But Dr. Terry Alani is here, and Dr. Barry Heaton, who, by the way, was the first man to do implants right here in Houston. It's good to know. So what's interesting is that Dr. Alani and I talked about this at the beginning of when she started doing these segments, and she's so great about saying, you know what, I know as a dentist what I should do, and then I know when to say, you need to see an orthodontist, you need to see a periodontist. And I think that is incredibly responsible, because a lot of dentists are taking on everything, and you went to school 3 extra years or 4 extra years to learn periodontics. So anyway, I want to get to, first of all, okay, so let's say the average person, they don't like their teeth, they're missing a tooth, or you know, they're having pain in a tooth. What do? We come to you, and what happens?
Okay, what a lot of people need to know, patients out there, is that unlike medicine, the dentist is actually the gatekeeper, the general dentist. Mm-hmm. And I'm a general dentist, and what we do is the patient comes to see us first, we assess the treatment that's needed, and then if need be, we refer to the specialist. And a lot of patients out there don't realize that. Unlike medicine, where you break a bone, you usually go see an orthopedic surgeon. Mm-hmm. In dentistry, you break a tooth, you come see us. Mm-hmm. Maybe the tooth needs to be extracted, maybe it needs to have an implant, maybe they need orthodontics to try to correct the situation. Mm-hmm. We're the ones that refer to the specialist. So a lot of people need to know that, patients need to know that.
And then, so I come to you and I look like this at the top. And I say, I need a tooth. Clearly, maybe I had a baseball accident. Maybe this would be more like me. Maybe I was eating a lollipop or a big, chunk of candy, whatever. So, but I need a tooth replaced. So you say, you know what, Whitney, you need to go see Dr. Heaton. So then I come to you and you say, what?
Well, when you come to me, the first thing we do is an assessment of the amount of bone that you have, because that's the key as far as implant placement. After I've gotten the treatment plan from Dr. Alani, she tells me what she needs as far as the tooth, and then I do the foundation. Periodontists, we handle gum and bone problems. Perio means around, dontics means the tooth. So we're the foundation guys. We do the slab.
See, I remember, yes, because I said to Terry, we were talking about something, and you said, well, no, you would see a periodontist for that, because oftentimes you don't have to, if you wanted to get caps or something, she said you can just have your gums lifted, and she said, but I wouldn't do that, because I don't know the gums in and out like a periodontist would do, but I could suggest it to you.
Right, yes, and what we do is we actually take the treatment plan, and it's very comprehensive, and then we know exactly, we're like the architects, and we know exactly who to refer to. As far as a dental implant goes, I'm going to have a little example here. It's an artificial titanium root.
And don't worry, ladies and gentlemen, this is not the size of it, okay? This is not the actual size.
The size of it, but
a defensive lineman in the NFL, this is actually their size.
Andre the Giant.
That's
there's
right.
Shaquille O'Neal. But,
wow.
But this is actually the artificial titanium root that goes into the jawbone. So it would look like this. This is the stub that comes out. That this screws in.
I'm going to show you this side. So this is the actual size.
Right.
This right here. And then this is what she's saying goes up in here.
And this is the stub that comes out, and then we end up putting a restoration or the crown. Of course, it won't be glass, but it'll be a really pretty porcelain crown that goes above the gum line. So Dr. Heaton, I refer to him, he's the one that actually puts the implant into the jawbone. then it heals for about 3 to 6 months, and then they come back to me and I restore it with the crown.
Oh, okay. So it is like teamwork.
Exactly.
Now, what's interesting is I was reading about how that when you put these in, it actually can stimulate the bone growth.
It can.
So that's important.
It's very important because whenever the implant's in place, it actually keeps you from losing that bone. You take a tooth out, the bone collapses, you actually have bone loss. This stimulates the bone and keeps it nice and full.
Now, these can also be anchors. Like, so you wouldn't have to have all new implants, let's say. Let's say you had these, you could have anchors right here that would then be, you could put false teeth here, right?
Good point, Whitney.
Well,
we have it right here.
Hey, let me see that. They're so tricky.
One of the biggest complaints people have about lower dentures is the fact there's no suction. We call them flip-flops. Remember the old flip-flops, you know, the shoes. So it really doesn't stay. So what we can do is we can put 4 anchors in.
Let me show this right here to this camera. So these are those anchors that you were just talking about how you put in. That's this big thing right here. Okay, but they're not this size again, don't worry. And then you take the dentures and you can anchor them to this, right?
Exactly. And when you put it in, I don't know if your audience can hear this, but
did you hear that?
and then
look at, he's so savvy.
And
He's
you
put it
can be
next to the
very
mic.
secure because a lot of people that are missing teeth are very self-conscious and insecure. And implants are the most functionally effective and aesthetically natural restorations that there are. I mean, they're proven. They have had a really good track record. I think in the last 5 years, the proven results, if I'm not mistaken, the statistics are 95% results very effective for the lower jaw and 90% for the upper. The reason the upper is a little bit less is because your bone is less dense and you might have a little bit of some failures.
That's a good investment then. That 90% investment rate, that's rare.
it really is. And we have another model here too that we can show. If a patient is unfortunate enough to lose a tooth, they have an option. This is what a bridge looks like.
Oh yeah, bridges. We've always heard about that.
If Terry is going to make a bridge, you grind the 2 teeth down.
On either side of the space.
On either side. So you basically turn the teeth into a nub.
So you grind them into a nub.
And then this...
It's always fun. Sounds fun, right, ladies and gentlemen? And then this tooth is a bridge.
It's just one
I never
unit.
knew what a bridge was.
There
it's
it
one
is.
tooth in there.
It's 3 pieces joined together. So you have to take 2 structure weight on either side of the space.
So these are the 2, and then this is the bridge that you like. This third one. See, my hands are so big, I can't really show you. There you go. And then you just sort of plop it in right there. Ooh, just kidding. I'm glad I'm not a dentist. I'm glad I'm not a periodontist or a dentist.
Now rotate it around, and then
and then
the other option is not grind the 2 teeth down and have an implant place, so it's one.
So it's one crown.
And you know, we can do implants also for the front teeth, not just the back teeth. I've done implants for children 18 years old and up. If they're congenitally missing their lateral incisors, or they've got knocked out in a football injury or whatever, I mean, it's amazing, and you can't really tell. I mean, am I right? They're just amazing.
Do you have, no, I'm kidding.
If we would, we wouldn't tell you.
We wouldn't tell you in all of Houston, right? I want to thank you so much. We can get a hold of Dr. Terry Alani right there, 713-621-5141. Call her. Plus, she'll talk to you too. She'll pick up the phone and be like, so what do you have? What's wrong? Talk to me about it. So anyway, thank you so much, Dr. Heaton, for being here. All right, stick with us. We have a whole lot more when we come back. We'll be right back.